History of United States healthcare billing. In the United States, healthcare payment comes from individuals via insurance premiums and out-of-pocket costs, and payers, private insurance companies, and/or government agencies. Additionally, healthcare costs represented 17.9% of GDP in 2014, and CMS expects healthcare costs to increase to 20% of GDP by 2024. This exhibit explores America's complex history of medical billing. During this presentation, we will walk through the 7 exhibits that will be on display during this engagement. Exhibit 1, Company Town Doctor. Like many companies in the late 19th and early 20th century, Pullman Car Company created a company town in Pullman, Illinois. These towns were meant to block outside influences in order to retain employees. One benefit of many company towns was a company doctor or even a company health clinic. The billing model during this era, instead of billing each patient, many companies would hire medical professionals as an employee and then deduct these salaries plus cost of medical supplies from the employee's pay. In this case, the exhibit itself will be a replica of a doctor's office and an actual employee health record from Pullman. Exhibit 2, Healthcare Strike Signs. During the early 20th century, the U.S. government did not support subsidies for what was then referred to as voluntary sick insurance. In the absence of government leadership, private insurance companies began to form in the late 1920s and early 1930s. Billing during this era. Examples from Blue Cross at this time are a prepaid hospital plan or physician reimbursement plans. The exhibit itself in this case will be strike signs from employees with healthcare-related slogans. Exhibit 3, Nonprofit Healthcare. The National Labor Relations Act of 1935 began to lay the foundation for employer-based healthcare, with the employee and employer both footing part of the healthcare expense burden. During this period, nonprofit health insurance companies guaranteed services for a fixed fee. The billing model during this era. Policies for hospitalization only were popular, and all customers paid a flat fee insurance premium. All other health-related expenses were paid out of the patient's pocket. In this case, the exhibit will be a replica sales booth from Blue Cross and Blue Shield circa 1930. Exhibit 4, Government Subsidies. Following World War II, the United States sought to prevent hyperinflation that was hitting Germany, and preventing labor strikes was a key federal policy. Offering healthcare insurance was a popular concession made to unions during this period. Billing during this period, employers received a 100% tax deduction for healthcare. Additionally, employees did not have to claim healthcare as taxable income. Billing and pricing agreements continued to occur between employers and health insurance companies. The exhibit in this case will be an actual circa 1940s Blue Cross mobile clinic. Exhibit 5, Medicaid and Medicare Act. The Medicaid and Medicare Act of 1965 provided government health insurance to the elderly, disabled, and lower-income Americans. The billing model during this era was expanded to include federal and state resources used to pay medical providers for the elderly, disabled, and lower-income Americans. The exhibit in this case will feature the PIN LBJ used to sign this act in 1965. Exhibit 6, Health Insurance Portability and Accountability Act, or HIPAA. In 1996, the Health Insurance Portability and Accountability Act, HIPAA, was enacted. HIPAA required the standardization of medical codes. The act also required electronic health records and electronic health claims. Changes to the billing model during this era. In the United States, healthcare payment comes from individuals, payers, and providers enter into cost agreements. However, billing does not provide consumers with a clear understanding of their cost of care. The exhibit in this case will be the pen that President Clinton used to sign HIPAA into law. Exhibit 7, Affordable Care Act. The ACA called for the following changes: Medicaid and CHIP expansion, subsidized coverage, consumer protection for pre-existing conditions, essential benefits, and young adult coverage. For those without an employer or government-provided health coverage, an online insurance exchange was established to connect consumers with ACA-compliant insurance policies. Billing for the ACA policies was broken down into several levels. The bronze, where the insurer pays 60% of medical costs and the payholder pays 40%. Silver, the insurer pays 70% of medical costs and the plan holder pays 30%. Gold, the insurer pays 80% of medical costs and the plan holder pays 20%. Platinum, the insurer pays 90% of medical costs and the plan holder pays 10% of the cost. Despite all of this, cost transparency for consumers remains elusive. The exhibit in this case will be a pen that President Obama signed to enact the ACA. As you leave the exhibit, please be sure to stop by the kiosk where you can see videos of everyday Americans concerned about health care and planning to vote in the 2018 election.